Anti-inflammatory drugs. Anti-inflammatory drugs. NSAIDs. Non-steroidal anti-inflammatory drugs. Description: these drugs reduce inflammation, pain, and fever by inhibiting cyclooxygenase (COX) enzymes, which decreases prostaglandin production. They are used for conditions like arthritis, musculoskeletal pain, headaches, and dysmenorrhea. Many are available OTC, Ibuprofen, Naproxen, aspirin, while others are prescription only. Common PTC examples frequently tested in top 200. Advil, Motrin, Ibuprofen. Aleve, Naproxen, Naproxen. Bayer, Ecitrin, also antiplatelet at low doses, aspirin. A Celebrex, COX-2 selective, celecoxib. A Voltaren, Cataflam, diclofenac. Mobic, meloxicam. Indocin, indomethacin. Toradol, often injectable, ketorolac. 1. Ibuprofen, Advil, Motrin. Classification: non-selective NSAID, propionic acid derivative. Clinical use: mild to moderate pain, fever, and primary dysmenorrhea. Key fact: it has a relatively short half-life, approximate 2 hours, requiring dosing every 4 to 6 hours. It is considered one of the safer NSAIDs for the stomach when used short-term. 2. Naproxen, Aleve, Naproxen. Classification: non-selective NSAID. Clinical use: arthritis, rheumatoid arthritis, RA, and osteoarthritis, OA, acute gout, and menstrual cramps. Key fact: unlike ibuprofen, naproxen has a longer half-life, 12 to 15 hours, allowing for twice-daily (BID) dosing. Studies often suggest it may have a slightly lower cardiovascular risk profile compared to other non-selective NSAIDs. 3. Aspirin, Bayer, Ecitrin. Classification: salicylate irreversible COX inhibitor. Clinical use: pain, inflammation, high dose, cardioprotection, low dose. Key fact: aspirin is unique because it irreversibly inhibits COX-1 in platelets for their entire lifespan, 7 to 10 days. Low dose: 81 mg used as an antiplatelet agent to prevent heart attacks and strokes. High dose: used for anti-inflammatory effects, though rarely used this way today due to GI toxicity. 4. Celecoxib, Celebrex. Classification: COX-2 selective inhibitor. Clinical use: osteoarthritis, rheumatoid arthritis, and acute pain. Key fact: designed to target the COX-2 enzyme inflammation, while sparing COX-1 stomach lining protection. This leads to a lower risk of GI ulcers, but potentially carries a higher risk of cardiovascular events in certain patients. Important: sulfa allergy. Celebrex contains a sulfonamide moiety. It is traditionally contraindicated in patients with a demonstrated sulfa allergy. 5. Diclofenac, Voltaren, Cataflam. Classification: non-selective NSAID, acetic acid derivative. Clinical use: intense inflammatory pain, migraine, and actinic keratosis. Key fact: often used as a topical gel, Voltaren gel, to provide localized relief with lower systemic absorption, reducing the risk of stomach and heart side effects. 6. Meloxicam, Mobic. Classification: non-steroidal anti-inflammatory drug, NSAID, in the enolic acid, oxycum, class. It functions by inhibiting COX-2, typically with less gastrointestinal distress than non-selective NSAIDs. Relatively COX-2 selective at lower doses. Clinical use: long-term management of osteoarthritis and rheumatoid arthritis. Key fact: its primary advantage is once-daily dosing, which significantly improves patient compliance for chronic conditions. 7. Indomethacin, Indocin. Classification: potent non-selective NSAID. Clinical use: acute gouty arthritis, ankylosing spondylitis, and closure of patent ductus arteriosus, PDA, in neonates. Key fact: highly effective but known for a high rate of CNS side effects, particularly severe frontal headaches and dizziness. 8. Ketorolac, Toradol. Classification: potent non-selective NSAID. Clinical use: short-term up to 5 days. Management of moderate to severe acute pain, often post-surgery. Key fact: available in injectable 4 intravenous, IM, intramuscular, and oral forms. It is so potent that it is often compared to opioids for pain relief. Warning: the 5-day rule. Ketorolac has a black box warning limiting its use to a maximum of 5 days. Extended use significantly increases the risk of serious GI bleeding and renal, kidney, failure. Prescription-only Rx-only NSAIDs. These medications are never available without a prescription, usually due to their high potency or specific side effect profiles that require close medical monitoring. Celebrex, the only COX-2 selective inhibitor currently on the U.S. market. Because it carries specific cardiovascular risks and requires a sulfi-allergy check, it remains Rx only. Meloxicam, Mobic, known for its once-daily dosing. It is a potent enolic acid derivative and is only available via prescription. Indomethacin, Indocin, one of the most potent NSAIDs with a high incidence of CNS and GI side effects. It is strictly Rx only. Ketorolac, Toradol, due to the extreme risk of renal failure and GI bleeding, hence the 5-day limit. This is a highly controlled prescription-only medication. Both OTC and Rx, dose-dependent. For these drugs, the strength and dosage form determine if they are OTC or Rx. In a pharmacy, the Rx version often comes in a larger bottle with a higher milligram count. Ibuprofen, Advil, Motrin. OTC, 200 mg tablets. Rx, 400 mg, 600 mg, and 800 mg tablets. Naproxen, Aleve, Naproxen. OTC, 220 mg tablets. Naproxen sodium. Rx, 250 mg, 375 mg, and 500 mg tablets, usually as naproxen. Diclofenac, Voltaren. OTC, Voltaren arthritis pain gel, 1%, is available over the counter. Rx, all oral tablets. Cataflam, Voltaren XR, and higher strength topical patches/solutions remain Rx only. Aspirin, Bayer, Ecotrin. While high-dose aspirin for specific conditions like rheumatic fever might be written as a prescription, for nearly all common uses, including low-dose antiplatelet therapy, it is an OTC product. Pharmacy law note: even if a drug is available OTC like ibuprofen 200 mg, a doctor may still write a prescription for it. This is often done for insurance purposes, so the patient doesn't pay out of pocket, or to ensure the instructions are part of the patient's official medical record.